I'm Dr. Dunkin with Brainwell Psychiatry in Bastrop, Texas. We're here today to talk about mental health and questions that we often hear from people when they're not sure what it looks like to get help and to see a psychiatrist. I have Kyla with me today. She works in the practice and she helps with TMS and other areas. And so we're just going to visit today, and Kyla's got some questions that she has come up with that she's going to ask me. So Kyla, what do you have for me today?
I think I just want to know a little bit more about Brainwell and what we do here. What services do we offer here?
Yeah, that's a good question. So at Brainwell Psychiatry, we have been here in Bastrop since 2019, and we are a practice that sees patients for general psychiatry starting at age 18 and up. We see for all different kinds of psychiatric problems, including ADHD and depression, bipolar, anxiety, just any kind of problems that people are having. We take insurance, which is really important. Sometimes it's hard to find a psychiatrist that takes insurance, and so we take most major insurances. We take Medicare, and so we're really trying to meet the mental health needs of the community. And we have multiple providers here so that we have better access. And we have special treatments like TMS and Spravato, which are cutting-edge, newest treatments available in psychiatry. It's really exciting.
That's amazing. I love that. You mentioned TMS. For someone who's never heard of it, could you explain it in plain language?
Yeah. Well, first of all, TMS stands for transcranial magnetic stimulation. And it uses magnet and electrical magnetic impulse as a treatment. And so typically when we think of treating depression, we have always used medications, chemicals that you take and you swallow, and it goes all over your body and changes the neurotransmitters in your brain, what's going on in your brain. TMS bypasses the rest of your body, and we use magnetic energy right near the scalp in the area that we know will help wake the brain up. And so there's very few side effects to it, and people tolerate it really well. It's kind of like an MRI. It's the same kind of magnetic technology as an MRI, just a lot milder than an MRI.
Right. And what made you have that decision to bring TMS into your practice?
Yeah, that's a good question. So, one of the hardest things about being a psychiatrist is wanting to help everybody and wanting people to get better. And a lot of people that come to the practice, we can just prescribe a simple medication and they'll get better. Really, probably the majority of people. There's a certain number of people who medications just don't work for them, or they have side effects to medication. And that can be weight gain, it can be problems with sleep. There's just all different things. And so when I started my practice and I had those patients that I couldn't get better with medication, I really wanted to know what else is available for that. And then TMS became available, and I thought, that would be a really great thing to be able to add to this practice is to have TMS available. Most times people can only do that in a big city, because that's where the availability is. So we're really fortunate in Bastrop that we have that here. And so especially when you get more east of here and people are even further away from Austin and it's harder to get it done, this has really helped serve this rural community with an ability to get a cutting edge treatment that insurance pays for. That's the huge part. Insurance does cover TMS, and it is so effective.
That's great. I love that. And you did mention that you wanted to bring TMS in for those people that you couldn't get better with medication. So what kinds of people are candidates for TMS?
So with TMS, you do have to meet some criteria for insurance to be willing to cover it. And one of those is that you have to be treatment resistant. And what treatment resistant means is that you have tried a couple of medications and they just haven't worked. And they say 2 medications, and so you've had 2 medication trials. Or you've tried medication and you've just had side effects and you don't tolerate medications. And so that's the criteria. Most other things are not, there's not so hard, except for maybe if you've had some kind of brain bleed. And so if there's been a problem with that, then we might have to take pause and decide whether that's going to be the right treatment for you. But most people are eligible.
A lot of people might be curious, does it hurt? Because it's this coil that's on your head. What does it feel like?
Yeah, that's a good question. When people first come for TMS, they're very anxious because they don't know what to expect. And so just to kind of describe it a little bit, there's a plastic coil. It's inside this plastic device, and it just sets right on your head here. We do some measurements to decide where to put it. And it's just a solid piece of plastic, so nothing's actually moving on there. But inside, when the magnet disperses its energy, it causes like a little tapping feeling. And so people will say it feels like a woodpecker is just kind of tapping on their head. And at first that can be a little bit uncomfortable. People will feel like it's a little sore. But after a few days, most everybody just tolerates it really well. And really kind of the main side effect, just some localized tenderness at the area because the scalp kind of contracts and it causes some tenderness there. But really, I would say that's the only real side effect we see. It can disrupt sleep when you first start, but we don't really see that too much. People can have a headache with it when they first start, and we say if you do, just take some Tylenol or ibuprofen. But we really don't see a lot of that either. Most people just tolerate it really well.
With TMS, do most people keep taking their medications, or is it something that they will try to come off of their medications while they're doing TMS?
Yeah. So we do hear that question a lot. What do I do about my medications I'm on? And it kind of depends. If you've been on medication and medication's been partly helpful, but it hasn't been completely helpful, then we keep people on medication. Actually, when they did the trials for TMS, it was considered an augmentation. In other words, people were on medication and they added the TMS to that. And so usually people do stay on their medication. That way, after the TMS gets them better, we stay better with that. There are cases where people just aren't tolerating medication, and if you don't tolerate medication, well then that's a good place for what we call just having just the TMS, just by monotherapy, not with a medication.
What does a successful course of TMS treatment look like? Like once you've completed treatment, what kind of things would you expect to see out of a patient?
Yeah, so it's really exciting when we have somebody come in here and they are so depressed, and we see what typically happens is it's not overnight. You don't come in for one TMS session and the next day everything's wonderful, but we do see usually over 2 to 3 weeks people start getting. We use something called a PHQ-9, which is a survey, a questionnaire, and scores are usually very high, and every week we have that done and the scores just come down and down. And so I would say some of the main things, we see people from isolating, they're not leaving their house, they're not talking to friends, to now they have plans, they're finding joy, they're laughing, and we just see people come alive again. They find themselves again. They go back to that person that they thought they would. Some people come here and they're feeling really hopeless, like there's not a chance. They've tried so many medications and they're just not getting better. And it's kind of hard. Sometimes we have to help them have hope in the beginning because they don't have hope because they have been trying at it so long. But then we see them get back to their life, get back to work. We have people that have been off to even show up for work or haven't been able to get a new job, and they're getting jobs and they're seeing their friends and just enjoying life again.
That's so wonderful. I love that. What does a typical treatment look like as far as how many days they're coming? Are they here? How long are they here for? Those kinds of things.
Yeah. And so with TMS, we're looking at 36 sessions. And so that is what insurance covers. That's kind of the standard protocol. And you do those once a day for the first 6 weeks.
So I have read some things online about TMS causing seizures. Can you tell me a little bit about how safe TMS is?
Yeah. And so seizures are considered one of the possibilities of a side effect from TMS. However, it is very rare. We've never had anybody have a seizure in a treatment here. And actually, when you look at the actual numbers of how common it is, it's really about the same chance that you would have a seizure on an antidepressant. Because antidepressant medications do something called lowering the seizure threshold. And many medications can do that, and TMS is the same. But we take special cautions to make it even more rare by making sure our patients are getting enough sleep, because if you're getting very little sleep, that can cause a higher risk for seizure. So if you've come in, we're going to ask you every day how much sleep you have. If you've been using substances, if you've been drinking alcohol and you suddenly stop drinking alcohol, that can cause you to have a lower seizure threshold. And so we're taking all the precautions that we can to make sure that that doesn't happen. But like I said, very, very rare. We've never had anybody have a seizure.
What would you say is the biggest misconception that you've heard about TMS recently?
I think that sometimes people get it confused with ECT, electrical convulsion therapy, and they think that we're zapping their brain like we do with ECT, and very different, right? And so when people get ECT, which is a really important treatment for some people, we actually are causing a seizure, and the seizure is actually what helps people's brain kind of reset. Okay. With TMS, what we're using magnetic energy. And magnetic energy doesn't go very far. If you've ever played with magnets when you were a child, and then as soon as you get them apart, they don't have much strength. And so we put the magnetic energy right there, and we're just going right through the skull, and we're just doing the smallest little energy we can to penetrate the skull. And then we're like kind of hitting the little neurons there with this little energy and going, wake up. Wake up. And so it activates those neurons there just with the littlest bit of energy to help them to connect better. And so we're able to kind of reboot the circuitry in the brain.
What are the indications for TMS that we see on a daily or monthly basis?
Yeah. Here at Brainwell Psychiatry, we use TMS for depression, and we talked about treatment-resistant depression, right? People that have tried other treatments, and for OCD. And so those are two indications that TMS has FDA approval for and that insurance covers. There are people using TMS for other, there's actually research going on, and what we call off-label uses of TMS for PTSD, for trauma, for bipolar depression, but unfortunately those do not have FDA coverage, and insurance companies won't pay for those types. So mostly major depressive disorder and OCD at this point.
Without sharing anything identifying, has there been a TMS success story of a patient that has just kind of stuck with you?
We have a lot of great patients that have just done so well. I'm thinking of a person who came that, you know, some people have had a lifelong time of depression, and they've just kind of struggled with depression off and on their whole life. And sometimes, though, we have wonderful stories of that people finally get the help that they need. They've become hopeless about it, and TMS finally changes that. But the one I'm actually thinking about today was an individual who became really depressed. This person didn't have this lifelong history, but had a very, very deep depression, and had tried multiple medications with her primary care doctor, who finally said, you know, why don't you go to Brainwell Psychiatry and see what they can do. And she wasn't working. She was not smiling. She was very anxious. Her friends actually were kind of who said, you've got to go get help, because it had changed her as a person. And we watched her just come back to life. And it's so interesting because I don't know what somebody looks like without depression when they first come here. they've had depression from the time I've met them, and to relearn and be introduced to who this person is without depression can be really exciting. And so it's wonderful to watch somebody get their life back. I think it's important that we think about, when we think about antidepressants, we've all heard neurotransmitters, right? And antidepressants target neurotransmitters. And with TMS, what we're really doing is we're really targeting the circuit. And so different areas of the brain have to communicate with each other. And when depression happens, what we see, and we can actually see this if we put somebody in a functional MRI where we can see what's happening with their brain while we're talking to them, normally we see this very fluid motion happening with activity in the brain. But when people get depressed, it just stops. It gets very angular. So instead of seeing this fluid motion of information and processing, it's just very rigid and angular, and the brain just gets stuck. And what TMS does, it reboots that circuit so the different parts of the brain communicate. I like to think about it like this, is that normally when we come up with a situation in our life or a problem, we're able to look at it, and we can look at it from all different kinds of angles, and we can see, oh, that's really bad, but oh, and we have hope, and we can think about it. When people get depressed, they just can't do that. They have one angle, and that is bad. That is stuck. They cannot see how it's going to be any different. And with TMS, we reboot that, and the circuits start communicating, and now people can start looking at their problems and thinking about their life from all the different angles where they have hope and they're not in that stuck, depressed state. So it's really exciting.
How does the workbook come into play with rewiring, essentially, the brain?
Yeah, that's a good question. When people have been depressed for a long time, their brain gets kind of ruts of thought processes. And so the brain is kind of like, it wants to conserve energy. So if you have kind of the same thought process a lot, the brain makes more permanent connections with that thought. And so people get in these very negative thought patterns. And so with the workbook, what we're doing is cognitive behavior therapy. And so what that does is we start looking at thought patterns. And so if you've been thinking a certain way all the time, that's what you want to do. With the TMS, we allow the brain to rewire, but sometimes we have to train ourselves to have different thoughts as well. And so we start working on what is a better thought, what are some more thoughts. And then when we think of CBT, cognitive behavior therapy, there's the behavior part of that. And so we can have behaviors that aren't helping, like isolating and not eating well and not getting exercise. So the workbook helps you set goals to do something with a friend on the weekend, or to eat a better diet, or to have a little bit more structure. And so the workbook just kind of takes you through those while you're getting the treatment, while your brain is waking up and having better connections, and then we're just kind of giving it the guidelines on how to make those changes.
So you mentioned that it's a typical 36 sessions, Monday through Friday schedule for the first 6 weeks. How do patients normally feel about coming every day?
Yeah, so that's a really good question. When people are faced with the idea that they're going to have to come here 5 days a week, every day, that can seem kind of daunting, and they're not sure how. Well, first of all, if they're having a hard time getting out of bed, figuring out how to come to this office every day can be difficult.
Right.
But what we find is that people get to the point where they're really looking forward to coming. And I think a lot of that has to do with the personal relationship that they're building with, with you as our TMS technician, because you see them every day, and they really start having some interpersonal connection to you. And so people at first think that it's going to be difficult, but then actually what ends up happening is when we get to the end, they're like, oh, what am I going to do? It's been so important talking to you every day and having y'all here. And so sometimes we kind of really deal more with the other side where people can't come here every day anymore. And then also, we have flexibility. So while we need to get those 36 sessions in, the research has shown that it doesn't have to be sequential. So if you have to be out for appointments, or even you're going to be out of town for a wedding or something like that and miss 4 days, we just pick it up, and just as long as we get the total number of session ends. So there is some flexibility that you don't have to be here every day. And so at Brainwell Psychiatry, we really accommodate and help patients get the help that they need.
Right, that's amazing to know that you don't have to be here every day, but it's preferred, but life happens, you know?
That's right. So the question about whether somebody does therapy while they're getting treatment at Brainwell, whether it's with medications or with TMS or Spravato, our other treatment, I always recommend therapy as part of it. And so we do have that therapeutic part of TMS that happens in that workbook, but that's not a replacement for individual psychotherapy where somebody is working with a therapist. So we do recommend that people work with therapists if possible while they're getting TMS, and then the therapy work is so much more productive because the brain isn't stuck, right? We're getting the brain unstuck, and so now as the therapist is working with them, you have the ability to kind of internalize what's going on and make those changes while you're getting the treatment.